Echo TV is a co-production of Minnesota's Emergency and Community Health Outreach Collaborative of health, safety, ethnic and nonprofit agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO. I'm your host, Lillian McDonald. ECHO stands for Emergency, Community Health and Outreach. Our mission is to provide educational and emergency preparedness information in multiple languages on a variety of formats, including television. This particular program is about HIV/AIDS awareness and prevention, and we have a couple of guest experts to answer some questions. But first, let's get started with some background information. Please watch this.
HIV infection and AIDS are quickly becoming the worst epidemic in human history. None of us are immune, and there's still no vaccine or cure for this disease. The good news is that HIV and AIDS are totally preventable if people learn the facts and protect themselves. Human immunodeficiency virus, or HIV, is the virus that causes AIDS. HIV attacks the immune system and over time compromises the body's ability to fight germs that can make us sick. At that point, a doctor will determine if a person has AIDS. A person can be infected with HIV and may not develop AIDS for years. However, once a person has the HIV virus, they will always be able to infect others. That's why it's important to get tested and know if you have HIV and can infect others. Some people with AIDS die from complications caused by the disease, but others learn how to manage living with HIV/AIDS and extend their life with the help from an early diagnosis and medical treatments. HIV and AIDS are treatable, but not curable. To keep from getting infected with HIV, it's important to know how the virus is spread. The HIV infection cannot be spread casually from one person to another by shaking hands, hugging, kissing, coughing, sweating, or passing tears when crying. HIV cannot be spread by contact with objects, such as drinking glasses, swimming pools, toilet seats, or food. HIV cannot be spread from other living things like animals, pets, and insects. HIV can spread from person to person during anal, vaginal, or less commonly, oral sex. Sharing needles while injecting drugs, steroids, or vitamins, or using contaminated needles to create tattoos or body piercing can spread HIV. HIV can also be passed from an infected mother to her baby during pregnancy, childbirth, or breastfeeding. To keep from getting infected with HIV, know how to protect yourself. Correctly using latex condoms during sex can help reduce the chances of becoming infected with HIV. The only sure ways to prevent the sexual transmission of HIV virus are either to show your affection without engaging in sex or be in a committed relationship with someone who has tested negative for HIV. If you need to take medications through injections, or if you choose to get a tattoo or body piercing, use a clean syringe or needle. And an infected pregnant woman can almost eliminate the chance of infecting her unborn child if she receives early medical treatments and care during pregnancy and birth. Although the virus itself does not go away once you're infected, HIV/AIDS is not always a fatal disease. Early diagnosis and treatment can prolong people's lives for years. The HIV test is easy and affordable, and the results are not shared with anyone without your permission. Verifying insurance or citizenship are not required to take the test, and the results are kept private between you and your medical professional. HIV is now a more manageable disease when diagnosed early and treated. There are medicines to help manage the virus and to treat diseases that result from compromised immune systems. However, it's important to know there are side effects from the medicines. Counseling, peer support groups, and treatments are offered to those who test positive. HIV/AIDS can be prevented and treated. The best way to care for yourself and your family is to know the facts, use condoms correctly, get tested, and know where to get help.
Welcome back. I'm Lillian McDonald. You're watching ECHO. Our program this time is HIV/AIDS, awareness and prevention. And we're very fortunate to have two qualified experts to join us for this discussion today. I'd like to welcome Neville Ansley from the Red Cross Twin Cities chapter, and also Tuan Tran from the Minnesota Department of Health. Thank you, gentlemen, for joining us. Sure. Old topic. I mean, how long have we been aware of the HIV/AIDS issue?
Since we've been testing for HIV in blood banks since 1985.
So the information has been around for a long time, but
right.
but clearly there's always some misconceptions about the answers, and hence a need to revisit this topic. And ECHO's lucky to be able to do that. Let's just start by Tuan. Let me just ask you first: why is this so important? It's an old topic, but why is it so important, especially now?
Well, it's extremely important and very relevant because when speaking about some of our immigrant populations, specifically Africans and Latinos, have one of the highest rates of HIV infection in Minnesota. Now, Southeast Asians in Minnesota do not have as high of documented cases as some of the other population, but nationwide, that population have increased infection rates as well. With all these populations, the rates of testing, HIV testing, is low. So we're thinking that the actual number of people living with HIV is significantly higher than that documented.
So get tested and we get a more accurate record of just exactly what's going on with the HIV/AIDS situation.
Absolutely.
Obviously across all cultures then.
Yes.
Okay. What is HIV? This is the basics. And how is it spread? Because I know I still hear people say, oh, it's this or that, and in fact, it's not this or that. So simply put, what is HIV and how is it spread?
HIV is the human immunodeficiency virus. It's a virus that causes AIDS. And even 25 years later, we still have a fair amount of stigma about this virus. It's spread by 4 body fluids: blood, semen, vaginal fluids, or breast milk. It's spread by anal, oral, or vaginal sex with an infected person, through needles and syringes, body-piercing tattoos, and sometimes from mother to child during birth or pregnancy and breastfeeding.
But the misconceptions are, and I think people just sort of lump all diseases in one pile. This one's clearly preventable, and it's clearly not to be confused with how other viruses are spread.
Yeah. Now, Lillian, with this virus, I found that because it's predominantly an STD, if we look at it statistically...
And an STD, sexually transmitted disease.
A sexually transmitted disease. There seems to be a greater stigma attached to it because of that. And yet it is spread by other practices. Sharing a needle with somebody who may be infected can spread this virus.
Getting your ears pierced or a body tattoo with needles that aren't clean. It's not spread by kissing, shaking hands, or anything else?
No, you can't get it from drinking glasses, kitchen utensils, dining rooms, restaurants, bathrooms. You can't get it off the toilet seat. In fact, there are just so many ways this virus is not spread. It's actually easier to talk about the ways it is spread because they are preventable. It's 100% preventable.
Okay. What's AIDS?
AIDS is acquired immune deficiency syndrome. And Neville, you and Lillian brought up a very important point. Acquired means that an individual can contract it. Immune deficiencies means that your natural body defense gets weakened, and syndrome means a list of health conditions that makes up this disease. Now, AIDS is the latter part of an HIV infection where the body's natural immune system is weakened so that the body's normal defenses to fight off some of the other infections it doesn't work. It doesn't function properly. Patients with AIDS may develop such symptoms as weight loss, chronic yeast infection, fever, tiredness, pneumonia, other infections that do not normally affect people with healthy immune system. And these are symptoms of immune deficiency. And one thing that I want to stress is only a doctor can diagnose AIDS.
Okay. These symptoms show up right away, or does this show up over time?
It depends on the individual. It depends on the individual lifestyle, how an individual take care of themselves. That's why early treatment, early detection and treatment is extremely important.
Okay. What are some ways, simple ways that people can prevent the spread of HIV?
Well, the most effective way is get educated. Find out how this virus is spread, what are the fluids that carry it, and then take action to prevent coming in contact with those fluids. Getting into a single relationship, long-term relationships with only one person, using barriers such as latex or polyurethane condoms, male or female condom. These are all ways that this virus can be greatly reduced. I can't emphasize the importance of education. Education allows us to make choices, without which we can't make those choices. If people don't have this information, they can't choose to avoid infection. If they have this information, they're empowered to make different decisions in their lives.
Yeah, but let's go back to the fact that, this is sex education in some ways. And I think people are afraid to talk about these things, even in this day and age when, it's on the internet, everything's out there. But people are afraid to talk about it. Now, in communities of color in particular, there are issues around this. Can you speak to that?
You bring up a very important point, Lillian, is that a lot of culture, including some of our Puritan, but a lot of cultures, immigrant cultures, dialogue about sex or sexually transmitted disease is not encouraged or doesn't occur at all. And that's why this program is so important, so that we can have that dialogue, so that we can have that open and honest discussion about prevention.
And in several places, arenas, whether you're having a dialogue at home, whether you're having dialogue with teachers, whether you're having dialogue with physicians,
Absolutely.
Because there is a wealth of information out there. But some of these immigrant populations, and you know what, across all cultures, this isn't unique to any particular population, there's some shame issues and some fear issues surrounding the subject matter. If you can, either of you just touch on that.
Well, it comes from their cultures, and a lot of the cultures, male and female groups, do not mix and discuss sexual issues. If it's discussed, women will discuss it on their own, and in other settings, men will discuss it on their own. There are religious issues involved. Some people believe that, if they're going to get it, they're going to get it, and this is ordained. If we can just address the issue about what are these fluids that spread it, how they pass from person to person, we can prevent this virus.
Great. Who's most at risk of getting the virus?
Well, anyone that has been exposed to some of the fluids, to the fluids that Neville has mentioned earlier. But those most at risk are what you and Neville just alluded to. People who think that they're in a long-term monogamous relationship where there's trust is a factor, but discussion is not, and they don't know the status of their partners. People who have multiple sex partners who have unprotected sex. People who travel overseas or back to their homelands where rates of infection are extremely high and have multiple sex partner. Again, unprotected sex. The youth are at high risk for the same type of behavior that puts adults at high risk. But add to that equation the belief or the attitude that youth are invincible, or that that HIV.
Remember that feeling?
Yeah, exactly.
It's not going to happen to me.
Right.
But in fact, without that education, it can happen to you.
And unlike the 80s, where AIDS is new and people lose friends and peers over AIDS. Because of the treatment, youth, don't lose friends or peers, and they don't think that it's affecting them, but they take risks because of that, whether it's sexually or experimenting with drugs and IV. Let's
talk a little bit about, we've talked about the sexual activities around the HIV/AIDS virus, but when you go in for a body piercing, what can I look for when I go to places like that, so I'm guaranteed that I'm going to be okay?
I often say to groups of people, if we were walking into a hospital for surgery and the place looked like a dump and it smelled like a garbage dump,
Probably wouldn't go there.
We wouldn't go there. And the same would apply to a dentist's office, and the same would apply to a doctor's surgery. And so we have this perception of what we expect when we look for medical treatment. Well, that principle, that expectation should carry over into doing body piercing and tattooing, because the one thing about this virus, we can only treat it, we can't cure it. It is irreversible once infection occurs. And so a person really needs to understand that if a place doesn't look clean, doesn't smell clean, the chances are it isn't clean. And if the guy or the person who's actually doing the tattoo is not protecting themselves by using universal precautions such as latex gloves and that, the chances are they're not protecting their clients.
They're sending you a message in another way, so pay attention.
And that goes in line with, as you stated earlier, high risk, using contaminated needles, sharing needles for IVG. That's extremely high risk.
What happens during HIV testing? Because obviously, if I'm in a situation where maybe I ought to just go ahead and get tested tested, find out where I'm at right now, so that I can figure out where I'm going in the future. What can I expect?
Well, there's a lot of resources in the state of Minnesota. The state of community health clinics, your doctors, they can provide HIV tests, even community health educator or outreach workers. And there's a couple of different kinds of tests. There's the confidential test, and then there's an anonymous test where individuals don't have to give their names, age, personal information, citizenship status, or immigration status. It's a very simple test, and you can get your results within minutes, depending on the test, or if it's a blood drawn, it gets sent to the laboratory and you get your results in a couple of days. It's free sometimes, and sometimes some clinics it's very affordable, depending on your income. And
it's easy.
And it's easy.
Very painless.
Right. I do want to emphasize a point, though. On the other option to anonymous testing is the confidential testing. And with confidential testing, your results are between you and your medical provider. That medical provider, by law, cannot disclose your results to anyone else, even if it's your family member. HIV test results are reported to the Minnesota Department of Health, though.
Right, and this is the same in other states. For states that may be watching this program, the information is the same. It's just you may have different resources in your state, but it's all pretty much the same information. How is HIV/AIDS tested? You said it's not curable, but it's treatable.
It's treatable. The most common test used for HIV is HIV antibodies. The immune system develops antibodies, and those antibodies are testable. And once a person has developed HIV antibodies, the chances are that they are infected with this virus. There is a period of time where a person can be infected and that they can test for HIV antibodies and they don't have it. If they have a drug issue, if they have an addiction, if they're on certain treatments, medical treatments, anything like that can suppress the immune system, and the immune system can take up to 3 months to develop antibodies. So getting into testing is really a good thing for anybody who feels they may be exposed to this virus, but realizing that there's a period of time that the body requires to produce antibodies is really important, because our false negative tests come out in that window period. People test in that window period, get a false negative, and they are infected.
There's a lot of information here. We've barely scratched the surface, and so we'd like to encourage folks to visit the ECHO website, www.echominnesota.org. We've listed several resources on here about testing, what it is, what it's not, and where you can go to find more information. Overall, we'd like you to remember 3 key messages in this particular program. The first is HIV is the virus that can cause a disease called AIDS that weakens the body's immune system. Next, HIV is transmitted during sex when condoms aren't used correctly or from using contaminated needles to inject or pierce. And finally, HIV infection is preventable and treatable, but not curable. Get tested and take care of yourself and your family. I'd like to thank both our guests for joining us today, Neville Ansley from the Twin Cities chapter of the Red Cross, and also Tuan Tran from the Minnesota Department of Health. Thank you very much for joining us. Really appreciate it. And thanks to our viewers, too, for watching ECHO, Emergency Community Health Outreach. We feature monthly information on this station. If you'd like to learn more about ECHO and its programs on educational emergency preparedness, please visit our website, www.echominnesota.org. I'm your host for now. Until next time, have a great day.
ECHO TV is a co-production of Minnesota's Emergency and Community Health Outreach Collaborative of health, safety, ethnic and nonprofit agencies, and TPT's Minnesota channel.